Welcome to Health Authority TV. I am Janan Sarwar, the Deputy Editor for Health Authority Books. It's a new imprint in partnership between Indie Books International and Global Bookshelves International. I'm honored today to introduce you all to Dr. Cory Jenks. He is a pharmacist, an author, and diabetes expert. Welcome, and thank you for joining me today.
Of course, it's my pleasure to be here. Thanks for sharing your platform.
Yeah. So if you don't mind, why don't you tell the audience who you serve as a health authority leader?
All right. Well, I think my who I serve is sort of there's multiple groups. So on a micro level in my day-to-day clinical practice, I serve patients. I manage type 2 diabetes under a collaborative practice agreement. I do a lot of obesity management, and really it all falls under the umbrella of metabolic health. So on a micro level, I am seeing patients in a clinic regularly. And on a macro level, I'm a speaker. An expert on diabetes and really I would say health transformation and wellness. And so I serve companies, leaders, mid-career professionals that are trying to shift their mindset on what it means to be healthy and honestly how to be healthy in a modern environment that makes it really easy to be unhealthy. So how I can help people is that I serve people individually with their health, but also serving as a speaker to large organizations working on that cultural side of health as well.
That is incredible. And, let's dig a little bit more into that as far as, being a speaker or being an expert on a topic. What is it that you really want to convey to the patients or the people that you're serving when you provide your service?
I think that what it comes down to is I can dispense information, I can literally dispense medications, but it ultimately comes down to that choice of taking self-ownership. I think health is one of those things that it's a crucial piece of self-ownership, and you can't really delegate it to anybody else. And so, whether it's a patient I'm seeing face to face in my clinic or an audience or a company, I think that once we start taking that health as our own first step in self-leadership, a lot of great things follow. And if we decide to delegate it or push it off to someone else or a gadget or device, ultimately that catches up with you. And so from health, we get everything else. We get our happiness, we get our vitality, we get pr productivity, and you can lead yourself, you can lead your family, you can lead a company when you take care of your health. And I'm not just talking about things like blood sugar or weight or blood pressure. I mean, health encompasses relationships, the spiritual side of things, how we have all these different pillars that come together. And so while I'll talk on a tactical level of blood sugar, for example,
Yeah.
I think that if we ignore relationships or if we're miserable because we're starving ourselves our whole life, we're missing the big picture. And so health can mean many things beyond just the your measures when you go to the doctor and get your blood work done.
Absolutely. And, as a pharmacist, I think maybe people assume that you would be micro-focused on those types of aspects, but I hear like a very holistic approach to how you help people. And how long have you been doing all of this with your pharmacy career and just supporting people in these different ways?
Yeah, so I've been a pharmacist since 2011, and I think I've worked exclusively in ambulatory care for about 10 years now. As recorded this in 2025. And so for 10 years, it's just been a world of self-education, seeing what works, seeing what doesn't. And I think the rudest awakening to me as a pharmacist was realizing that just because we have the air quote right medication for a patient doesn't mean they're going to afford it, take it, like it, tolerate it, or want to even identify with that disease that they take that medication for. And so trying to realize my own limitations and what I'm able to quote unquote, tell people to do, and instead getting on their team, getting into their head and figuring out like why do they care or why do they not care? What are they willing to do? And then basically helping them on their own journey to wherever is best for them to get the outcome that they desire.
And so is one of the ways you do this through like what kind of services do you actually provide if someone wanted to work with you?
Yeah, so I have a clinical practice here in Tucson, Arizona. So you could literally sign up to be part of the primary care clinic that I'm in. And if you look up my name and want to find me, I'm not all over the internet, but I'm on the internet. So that's one option. For a more personalized approach and probably a more hands-on approach, I have a diabetes coaching program that I run with another pharmacist of mine. And that's going to be not diabetes man. It's not like management like as a pharmacist. It's a coaching program, and that's for people who are really looking to own their diabetes, reverse it, get off their medications. We have an online program for that, and then serving uh, organizations, companies that are looking to have a mindset shift with their leadership, their employees on what it means to be healthy. I do speaking and workshops for that as well. So I can help you one-on-one, or I can help inspire your group and provide sort of a mental roadmap to that idea of holistic wellness.
That is amazing. That's incredible. And, I know we've known each other in the pharmacy world for several years. I know you as an author, and I now know you as you've been flourishing with your speaking career. And just curious, a big question of based on your experience with all of this, how do you think we could redesign the healthcare system that's
Well,
existing today?
little tiny little question to end on, right? Easy peasy. So if we want to redesign the healthcare system, I think the first thing we need to acknowledge is, and most people will, that our current system is broken. If we see our doctor at best, I mean, the average primary care appointment is somewhere between 7 and 12 minutes. We'll round up and say even 20 minutes. We'll say 30 minutes. So if you see a primary care provider for 30 minutes, even twice a year, not just once a year, that's an hour of your year. That is not enough time to really go dig deep onto what is going to help you achieve your goals, achieve your optimal health. Now, if we extended those to 2 hours twice a year, I don't think that's enough time. So, as far as redesigning the healthcare system, I think it's got to come from the bottom up and really starting with empowering the individual to own their own health in a way that we've sort of outsourced to a system that's designed to, and we've all been there, felt a little bit ignored, felt a little bit
Yeah,
dehumanized by our healthcare system. So how can we provide tools to the individual patient, to the individual person, to a company to create a culture where we don't need to rely upon these services as much? Because if we are less sick, the system will change. So right
yeah,
now we have an overloaded system where it's hard to get in to see people, to see a provider, to see a specialist because we are so sick. So what steps can we take on an individual level? And I'm not here advocating we ignore doctors. I think there's an extreme to both sides. I'm not saying that.
right.
But if collectively we all got 10% healthier as a society
Hmm.
and we required 10% less services, 10% less money pumped into the system, I mean, that's a huge number. And I should have the number of dollars we spend every year on healthcare. But, 5 to 10% shift, a little shift will change the incentive structure for who is providing the healthcare, for the companies that are doing it, for the insurance companies. So I know there's a lot of fight from the top down of how we pay for it, how we do it. That's not the fight I want. The fight I want is to give people the tools to fight for their own health, and the system will change around it. And I mean, I see it. I see it at the store. There's 1,000 kinds of sparkling water now because people are drinking less soda. So if you don't think that we can change the healthcare system, we actually can, but it comes from an individual grassroots behavioral level, I think.
Absolutely. Yes. What an impact that could make. I think that's brilliant. And you're right about the sparkling soda, sparkling waters and everything. That's amazing. Thank you for sharing your idea. And, I'm curious if people wanted to stay in touch with you and the ideas that you have, the books you've written, the content, and the speaking engagements that you have, how can they follow you and stay in touch?
If you just go to my website, CoryJenks.com, and it's CoryJenks.com. There's no E in Cory. I was actually having this conversation with my parents last night. Originally, there was an E in my name, and my parents couldn't afford to buy the vowel. They were just a couple of teachers, so we took it out. There's a Wheel of Fortune joke for the three people
Yeah.
who ever watched a Wheel of Fortune. You can go to my website. I think professionally, one of the best ways to connect with me is LinkedIn. I really like to be active there. I have an Instagram, a Facebook. I'm on and off of X, so find me on LinkedIn or my website. Send me an email from my website. You can send me the email. It's just Cory@CoryJenks.com. So one of my favorite things to do is hear from people who've heard from me who's to say, Cory, your ideas are great, or your ideas are terrible. I'm open to all of it. I'm here learning and trying to improve on my journey. So I think that's the best way to get a hold of me. And from there, my website, you can find out I've written a couple of books. One's related to the healthcare system, maybe how we can shift it, called Permission to Care. One's more totally unrelated about being a dad. So, but if we're good fathers, maybe our kids will need the healthcare system less. So we'll see. But yeah, that's probably the very long way of saying go to my website.
We will link your website. I have read both of your books. I highly recommend. I still use tips from both of your books. And I'll highlight your fatherhood book also has health tips in it as well. We utilize a lot of your recipes, and I think it's great. So thank you. Thank you for your time today. And for everyone out there, yes, please connect with Cory. And for everyone, thank you for listening. And until next time, may you all be healthy, wealthy, and wise. Bye.